In this video, can you restore your kidney function if you only eat protein from plants? Additionally, does rice raise blood sugar levels? And can you use sodium bicarbonate if you are trying to limit sodium intake? To answer your question about sodium, we have received many interesting questions about kidney diets and supplements that actually help protect the kidneys. You know, the combinations and all the details that you want to learn more about. So let's start with a very interesting question. She asks, can amino acids restore kidney function if you avoid protein? Amino acids are actually a very important aspect of a kidney diet, and everyone should know about them. So, can you restore your kidney function using amino acids, and how does this work? First, many patients actually need amino acid supplementation to protect their kidneys. And that's not just my opinion, it's an actual guideline for kidney disease management, as you can see. But which amino acid should you take? Not all amino acids are created equal. In fact, there are two types of amino acids that have been used in medical literature to help protect kidney function. First, we have regular essential amino acids, EAAs. These are essentially the same amino acids that bodybuilders commonly use. While most CKD patients are not trying to gain muscle, these amino acids actually have some kidney protective properties. In fact, in a recent study, kidney disease patients were able to avoid dialysis when they were placed on a very low-protein diet supplemented with essential amino acids. What's interesting here is that this method also works for diabetic patients. Why is this important? Because diabetic patients are usually not advised to eat a very low-protein diet, just a low-protein diet. But now we know that they can also follow a very low-protein diet, which is great. Now, although the results of this study are remarkable, essential amino acids are not the ones you typically want to use. In reality, the amino acids you should look for are called keto analogs, and these are special amino acids designed to help kidney disease patients. As you can see, they are even more effective than regular essential amino acids in protecting the kidneys because they do not contain nitrogen, which is the toxic component of urea. So yes, amino acids do help. Once your very low-protein diet is established, add keto analogs to your regimen. This is how you protect your kidneys. If you cannot find keto analogs, or if your doctor does not prescribe them, or if they are too expensive, consider using essential amino acids. But remember, amino acids only help when you are on a low or very low protein diet. Another question about protein: is plant-based protein the only safe protein? Should we eat beans and nuts instead of meat? I have been eating cashews and walnuts daily. Walnuts and cashews are great choices. Walnuts are rich in omega-3, more than most other plant-based foods, and cashews are high in selenium and zinc, two of the most important antioxidants for kidney health. Cashews are particularly rich in unsaturated fats, a type of fat associated with a lower risk of early death and heart disease. The only downside of cashews is that they are particularly high in protein, even compared to other nuts. So is that a good thing? It's plant-based protein, so it must be safe, right? First of all, plant-based protein does not cause acidification like meat and dairy, and that's great. It also doesn't come with all the phosphorus found in animal protein. However, there is still one drawback: plant-based protein still produces nitrogen waste, though not as much as animal protein, which generates more toxins like p-cresol sulfate and indoxyl sulfate. So what should you do? You can eat walnuts, cashews, and other sources of plant-based protein, but in moderation. So, in summary, limiting your protein intake is the most important part of a kidney-friendly diet. And while it's impossible to completely avoid protein, it is true that plant-based protein is the only safe protein. Next up, are vitamin D and K2 safe? She asks, I've been taking vitamin D that contains vitamin K2. Do I need to change anything? So what's the deal with vitamin D and kidney health? This vitamin is crucial for protecting your kidneys. Low vitamin D levels are very common, especially in winter and in people with darker skin. But in reality, I've even seen fair-skinned people living in California with low vitamin D levels, so don't take your vitamin D lightly. Why does this matter? If you care about your kidneys, you should make sure you are never deficient in vitamin D. Low vitamin D levels are linked to proteinuria and kidney damage. The good news is that there's a simple test to check your levels. It's called the 25-hydroxy vitamin D test, and more doctors are finally ordering it, even for people without ESRD. This is surprising because they usually only order tests when your kidneys have already filed for early retirement. Is taking vitamin D with K2 safe? The short answer, yes. Not only is it safe, but it's actually a good idea, as long as it's in moderate doses. So please don't start taking 10,000 IU of vitamin D every day like it's candy. Okay, some influencers once advised that an average person should take 10,000 IU of vitamin D3 daily as a maintenance dose, and then suddenly changed their minds. I guess someone called them out on that mistake, or maybe their followers ended up in the hospital. Anyway, don't take anything like 10,000 IU of vitamin D daily. The maximum dose I recommend in cases of confirmed deficiency is 5,000 IU per day, but this needs to be closely monitored. If you're not deficient, you need even less. And get tested, know your levels. Don't overdose on vitamins. Alright, next is a question about one of the most effective supplements for kidney health, omega-3. He asks, how much omega-3 should I take? This depends on your goal because, as you see, omega-3 fatty acids are among the most researched supplements in the world. They are not only extremely effective in combating proteinuria and protecting kidney health, they can help with a long list of conditions. The lowest dose you see here is something that everyone should take daily. This is what I take, what my family members take, and what anyone over 50 or with any risk factors for heart disease should take. So, if you don't have time to learn more about omega-3, this is your answer. But as you can see, omega-3 is not just for prevention. Studies show that it can be used as an adjunct therapy to treat certain conditions, and depending on the condition you want to treat, the dosage may be higher. However, I do not recommend taking more than 500 milligrams per day of EPA and DHA without a doctor's approval, especially if you are on blood thinners. Higher doses of omega-3 can be used to treat conditions such as heart disease, high triglycerides, and inflammation in general. If you are one of those from Italy, remember that you can get omega-3 from your doctor for free, covered by taxpayers, if you have very high triglycerides, have had a heart attack, or are at risk for cardiovascular disease. But in most other countries, you will have to pay for your omega-3 yourself. Now, what is very interesting about omega-3 is that it can be used to treat proteinuria, especially in the case of IGF-1. You will need a high dose of omega-3 for that. Alright, and remember that the dosages you see are for EPA and DHA, not for fish oil. So, for example, if you want to take 1,000 milligrams of EPA and DHA, you will need to take about 2,000 milligrams of fish oil or 2 capsules, depending on the brand you are using. So, the short answer to the question how much omega-3 should you take is, take the lowest dose you see here. The long answer is, learn about omega-3, alright? Because you may want to take more, depending on the condition you want to treat. Now, if you find this information useful, don't forget to subscribe and turn on the notification bell so you won't miss my next video. Alright, moving on to the question about sodium bicarbonate. You ask, if a patient has end-stage kidney disease, can they use baking soda if their doctor has advised them to limit salt? Does baking soda contain a lot of salt? This is a very interesting question. Many patients need sodium bicarbonate, and everyone should limit their sodium intake. So, what should we do? Should we give up this life-saving supplement to reduce sodium intake? Are we stuck between two difficult choices? Not necessarily, because while it is true that sodium bicarbonate contains sodium, the actual sodium intake is what really matters. As you can see, no one is prescribing 10 grams of bicarbonate per day to CKD patients. What I see most patients being prescribed is a starting dose, and that amount of sodium bicarbonate contains only about 170 milligrams of sodium. Keep in mind that the daily sodium limit is 1,500 milligrams to 2,300 milligrams. So, can you still take baking soda or sodium bicarbonate if you need to limit sodium? Yes. While you obviously should not take a large amount of sodium bicarbonate, if you need it, ask for a prescription for it. Alright, a big question about the kidney diet. The common understanding is that white rice is better for kidney patients than brown rice because it has lower phosphorus and potassium. So why are you saying that brown rice is better for us than white rice? This is a crucial question regarding the development of the kidney diet. The issue is, the common understanding also states that kidney disease cannot be stopped or reversed. It also says that CKD patients will inevitably end up on dialysis sooner or later and that diet doesn't really matter. Well, that's no longer accurate because real-world clinical experience with CKD patients tells a very different story. People improve every day just by making smarter food choices, and guess what? Brown rice is definitely one of those better choices. Let's look at why brown rice is nutritionally superior to white rice. Let's consider an actual nutritional comparison. So, is brown rice really high in potassium and phosphorus? And most importantly, does that even make a meaningful difference? So, which should you eat, brown rice or white rice? Let's look at the numbers, potassium levels, phosphorus levels. But remember, even on a low potassium diet, you still need over 3,000 milligrams of potassium daily. And also, remember that we don't actually count phosphorus from plant-based foods. Now, if you still think white rice is healthier, what truly matters for a kidney-friendly diet is the amount of fiber, vitamins, magnesium, and antioxidants you get. That's why most patients are advised to eat brown rice as a daily staple, and very few are recommended white rice. In reality, white rice is mostly recommended for patients who are severely underweight and need a safe staple food to add more calories each day, even if it's not nutrient-dense. So, to sum it up, is white rice really superior to brown rice for CKD patients? No. Remember, when it comes to rice, the rule is, when in doubt, choose brown rice. Now, let's move on to another rice-related question. Does rice turn into sugar, and does that raise blood sugar? That's how you know it's serious. By the way, all these rice-related questions are because I recently made a video about a very innovative type of rice from Japan that has been scientifically proven to actually slow down kidney disease progression. So, does the rice you eat turn into sugar? All carbohydrates turn into sugar. That's literally how the body uses them. So, should we ban rice from our lives? What should we eat instead? Maybe fat? Great idea. But, You know, fat causes inflammation and clogs arteries. Seed oils? That's still fat, and they're actually pure evil in liquid form. That leaves protein, right? Well, you might ask, but everyone knows protein activates mTOR, which clearly causes cancer, aging, bad breath, and maybe even summons the IRS to audit you. So, what's left? The only solution is to go outside, stand in the rain and sun, and start photosynthesizing. Or maybe, we should all stop listening to nonsense on the internet. Here's the truth about carbohydrates and blood sugar. Yes, carbohydrates turn into sugar, but does that automatically make them bad? No. So, next time someone tries to scare you into avoiding carbs, think about this: short-term sugar spikes don't damage the kidneys. What truly harms the kidneys is years of persistently high blood sugar, the kind that stays elevated even when fasting. That's what leads to diabetes complications, CKD progression, and all the bad stuff. Not rice. So instead of panicking about what turns into sugar or what activates mTOR, why don't we just follow a diet that actually works? A diet that includes some carbohydrates, some healthy fats, and very little protein if you have kidney disease. So yes, you can eat rice. No, you don't need to become a plant. Switch to the question, what about PKD? How can PKD be treated? What can you do for PKD? Do your tips help with PKD? PKD stands for polycystic kidney disease. It is a hereditary kidney disease, meaning it does not occur due to diabetes or high blood pressure. Instead, it happens because of genetic mutations, which means young people can also be affected. PKD causes the growth of multiple cysts in the kidneys, gradually reducing kidney function. It often leads to high blood pressure, pain, and other symptoms. There have been significant advances in the treatment of PKD, with the most important being the FDA approval of tolvaptan, the first drug proven to slow the progression of PKD. Another area of research has been mTOR inhibitors like rapamycin, though they have not been as effective as initially hoped. But what about tips? Do they help with PKD? Yes, they do. I try to focus on tips that benefit most CKD patients, including those with PKD. For example, omega-3, which we just discussed, is being studied for its potential benefits in reducing inflammation and proteinuria in PKD. And of course, the kidney diet, one of the main topics, is also crucial for PKD. A low-protein diet is particularly important for managing PKD. However, unlike kidney diseases caused by diabetes or high blood pressure, PKD is genetic, meaning we cannot completely stop its progression. Still, new treatments like tolvaptan and a kidney-friendly diet can help slow the disease and improve quality of life. That's all for today. Thank you for watching, and God bless you. Goodbye.